Hello everyone. Today our whole team will present you a case study. Our neighborhood is Cabbage Town, St. James Town. We have a case as a senior man living alone, speaks only Bengali. His neighbors report hoarding behaviors. He attends a lunch group at the community center where they are members.
Definition of hoarding: a persistent difficulty discarding or parting with goods due to a perceived urge to save them is known as hoarding disorder. When a person with hoarding problem considers getting rid of their possessions, they become distressed. There is an excessive accumulation of objects, regardless of their true values. Hoarding ranges from mild to severe. In some cases, hoarding may not have much impact on client's life, while in other cases, it seriously affects persons functioning on daily basis. Examples of hoarding: excessive accumulation of products that are not required for which there is not enough room, having a hard time getting rid of or parting with your belongings, regardless of their actual values, having a strong desire to keep these goods and being distressed at the prospect of discarding them. Cluster accumulates to the point where rooms become uninhabitable. Indecisiveness, perfectionism, avoidance, procrastination, and issues with planning and organizations are all symptoms of indecisiveness. Hoarding sometimes results in confined living quarters with only narrow routes, meandering among mounds of debris. Countertops, sinks, stoves, desks, stairwells, and almost every other surface are generally piled high with clutter. When there is not enough space inside, the cluster may migrate to the garage, automobiles, yards, and other store areas. People frequently hoard everyday items like paper, for example, mail, newspapers, books, clothing, containers, boxes, and plastic bags. Some people keep waste or bad food in their homes. Animals or human waste products are more frequently hoarded.
Local statistics: hoarding problem affects every 2.6% of the population, with higher incidence among persons over 60 and those with comorbid psychiatric illnesses, including anxiety and sadness. Hoarding prevalence and characteristics appear to be consistent across countries and civilizations. Currently, researchers believe compulsive hoarding affects 1 in every 50 people, but it may affect as many as in every 20 people, and up to 5% of the world's population displays symptoms of clinically diagnosable hoarding. According to CTV News, it is estimated that between 1.5 and 6% of the Canadian population has a hoarding problem. The second one is 18% of the total population of the Cabbage Town are seniors above more than 65 years who might be at risk. On the other hand, 47.7% seniors lives alone who cannot be at risk of psychiatric illnesses.
Social determinants of health. The primary factors that shape the health of Canadians are not medical treatments or lifestyle choices, but rather the living conditions they experience. These conditions have come to be known as the social determinants of health. We have run down the social determinants of health for a case scenario. First is income and social status. The level of income shapes overall living conditions. It affects physiological functioning and influences health-related behaviors, such as the quality of a diet. In our case, the client is a senior. He is hoarding because he is afraid to run out of basic needs, since he is living in pension and retirement savings fund. Second is unemployment and job insecurity. This can cause material and self-deprivation. Next is food insecurity. Access to nutritious food impact on a patient's well-being. Individuals who can't afford to obtain quality food rich in vitamins run the risk of developing chronic illnesses or exacerbating illnesses that they might already have. Next is language barrier. The client only speaks Bengali. Patients and families with limited English proficiency face barriers to healthcare service access, experience lower quality care, and suffer worse health outcomes. Limited English proficiency is an independent driver of health disparities and exacerbates other social determinants of health. Next is basic amenities and environment. Our client lives in Cabbagetown. As for his basic needs, there is a lot in the area. The mode of transportation is very accessible. The only concern is the environment. It does not have enough recreational services for seniors. And although that it is actually accessible and near to everything, the crime rate is also high. As a senior, it puts him in a vulnerable situation. Next is culture. Culture is an important determinant of people's perception of health. Some cultures have different health practices and medical treatment. Next is social support. Having support from families, friends, and communities are linked to better health. Our client in this scenario is only living alone and does not have any support. So that greatly affects his health perceptions also, because he has no one to actually help him and lean to if he needs any help.
Barriers to health services and challenges. A barrier and challenge for this elderly man would be receiving health services and communicating his wishes, as he only speaks Bengali. It is known that only 1.5% of residents living in Toronto speak Bengali. The local high school has been teaching Bengali as a second language. A helpful tip for a nurse in a consideration is asking volunteer students from the local school to come in and communicate with him. Other barriers and challenges for this elderly man would be his income. The average elderly person only lives on the average CPP and OSA government assistance, which is about $1,100 a month. With TTC and Wheel-Trans easy accessible in Cabbagetown, this hopefully should not be an issue. He may have some mental concerns that would have to be addressed that could be associated with the hoarding. There may be other stuff as asthma and skin conditions that are also associated with the hoarding. Those are nursing considerations that must come in factor in assistance, providing assistance for this elderly man.
Good day, everyone. This is Joanne. I'm going to discuss the legislation or subsidies available for the client. First, for the federal programs, we have the OAS. This is for people who are 65 or older and live in Canada for more than 10 years. We have the Guaranteed Income Supplements. This is for Canadians who have low income. On top of the OAS, they could get this money. Next is the Canadian Pension Plan, or the CPP. These are for people who work in Canada and pays for the CPP. They could use this for their retirement. Next is for the provincial programs. Healthy Home Renovation Tax Credit. If you're a senior, 65 years or older, and lives in Ontario, you can apply for this credit to make your home more safer and more accessible. Next is for the City of Toronto. First, we have the Homemaker and Nurses Service.
Homemaker and Nurses Service is a program of the city which aims to help individuals like old people in housekeeping, laundry or shopping, and meal preparation. Next is Vulnerable Adults and Senior Team. The nurses will provide consultations to adults and seniors who are 50 years old or older. This program is for Toronto, and currently, because of COVID, they are closed right now, and then they will resume under further notice. Next is Supportive Housing Program. The City of Toronto made a community-based program which encourages independent living for senior in designated buildings. Services for health like checkups, medication reminders, light meal preparations, and health education are provided by nurses, PSW or RPNs. Next is paramedic clinic in select Toronto community housing buildings. These clinics provide weekly physical and mental monitoring to elderly patients. Next is a program outside of the home. It helps the elderly with the cost of medical supplies, dental care services, flu prevention, and community-based services are the services of the City of Toronto that could help the senior medically. And lastly, mental health services. There is a Toronto Seniors Hotline that supports the seniors and caregivers that provide information on how to deal with mental health crisis. That's all for the legislation and subsidies available for the client. Thank you.
Nursing considerations assessment tools. In this case, we need a very comprehensive assessment. Physical assessment normally is a head-to-toe assessment. Psychological assessment is important in this case. The client is a senior, has a hoarding behavior. We want to identify if he has any other mental health issues. The cultural assessment normally refer to the religious preference, family structure, and the food preference, etc. The hoarding behavior, we wanted to assess what the causes of the behavior, how severe it is. The social part is also important in this assessment because the social interaction is very important for human being, and when you're getting older, you have a higher risk of social isolation. And for the environmental assessment, we want to assess the living condition of the housing and the environment to identify any risk factors for health. In this case, we have some safety concerns. The client has the hoarding behavior, which put a risk for if the client moving around in the house. Also, it might be a fire hazard. After all the comprehensive assessment, we wanted to make a decision. Can this client live alone safely? There's normally three outcomes. The client is able to. The client is able to, however, need assistance. The client is not able to and need long-term care. This is a general approach for any person with hoarding behaviors. First, we have to respect our client and provide ethical care. Effective communication is very important. In this case, interpreter is beneficial. We also need to provide culturally sensitive care for this client. Health teaching and promote a healthy lifestyle is also important. Next, we want to address the hoarding behaviors, ensure the living condition is safe for the client. Also, we need a regular checkup to assess the client's health status. We need to work collaboratively with the community to provide more social events for seniors. Even though they are seniors, organizing some workshops for learning basic English might be helpful. We have different strategies to help the client according to their health status. If the client is able to live alone, we encourage them continue to be independent and also provide transportation service if needed. If they need assistance, we want to reach out to find more resources to help the client with daily living, like housing cleaning, meal preparation. If the client needs long-term care, we want to refer the client to the suitable long-term care facility.
Local resources includes community services and supports and senior programs. Community services and supports. Cabbagetown Dixon Hall Neighborhood Services. It is a housing support service in which there is provision of cleaning supplies, support around hoarding, assistance with decluttering spaces, and light housekeeping. Toronto Hoarding Support Services Network. The Toronto Hoarding Support Services Network is a group of 16 agencies working together to help Toronto area residents with problematic hoarding. It provides services to help and support clients in managing clutter, while providing emotional support required to live safely. This program is funded by the City of Toronto Centre, Support and Housing Administration for the City of Toronto Social Development, Finance and Administration. Sunnybrook Health Sciences Frederick Thompson Anxiety Disorder Center. The center runs a biotherapy group for individuals with hoarding disorder using the theme Buried in Treasure. The short-term therapy seems to be effective in reducing symptoms of hoarding behavior. The session happens every month, lasts for 15 weeks. Mood Disorders Association of Ontario. It's a free peer support group for people living with hoarding tendencies. No registration is required. Meetings are every first, third, and fourth Thursdays of each month from 7 p.m. to 8:50 p.m. Senior Programs. Crisis Outreach Services for Seniors. The Crisis Outreach Services for Seniors teams provide support for seniors with mental health or addiction in the City of Toronto. Partner associations work together to provide client and caregiver-focused services. City of Toronto Vulnerable Adults and Seniors. The team responds to family, community members, or agencies with concerns about people living in challenging situations like hoarding, unsanitary condition, complex mental and physical health conditions, and bedbugs. The vulnerable adults and seniors will be contacted within 3 business days. Help them make a plan of care and follows up and addresses appropriate services and supports.
Conclusions. Case study is a great method to do investigations of a person, group, or community. Mental health issues need to be assessed and addressed. Senior population need extra support to maintain their health. Social determinants of health and barriers to health services have big impact on the health outcome. Local statistics, legislation, and local resources are important information for helping healthcare professionals to provide quality care. This is our references. Thank you so much for watching.